Good evening, everybody. Welcome to the Dentist Show live. It is Sunday, and today we're having another conversation. Conversations that really have an impact in our community. And today we're talking about breast cancer awareness. It is pink is the pink month, as we all know. And so, really, I have three experts, two doctors, and somebody, Jules, as I call her, who's actually been through breast cancer. And she will share her story and how she set up her foundation, Pink Africa. And I think it's really important that we really keep on talking about breast cancer. Breast cancer is serious, and anyone should be aware of the risks, treatments for breast cancer. We're encouraging you all to learn more about breast cancer and take advantage of the resources that there is to offer before it becomes a big deal in your life. Last time the conversation was, how costly it is when you have breast cancer. It's a financial burden. It's an emotional burden on your family as well. So as much as possible, whilst we discuss breast cancer, it's important that you get screened. We can't shout out more about it than for you to really get screened. So I'm hoping that you're going to enjoy the conversation. And after this, if you haven't already been screened, that you will go out there and get screened. It's nice to see all the people that are on. Good evening, good evening, good evening. So I'm going to first of all introduce two of my guests. I've got Juliet and I've got Dr. Emilia. So welcome, ladies.
Thank you.
How's
Thank
Hi
everybody
you for
doing?
everyone.
having us. It is a pleasure to be here, as
Thank you,
always.
Jules. Thank you so much. Thank you. Now, to both of you, I know we have these conversations all the time, but why is breast cancer so important for us to discuss at this particular month? I'll start with Jules and then I'll go over to Doc.
So for me, I think it is something we need to discuss all year round because women suffer from breast cancer all year round. We don't wait to discuss it in October, but definitely more light is shed on it in October, which makes it really, really wonderful. Um, Early detection, bottom line, saves lives. It's why I'm standing here talking on this wonderful platform. But even more than that, in Africa, majority of us cannot afford the treatment of cancer. So the reality is when your tumors are caught early, it will not only save your life, but it will also be gentle on your pocket and on the community you live in. Because oftentimes we depend on our immediate community to pull through to help us out if we cannot afford it. So promoting and preaching early detection is paramount to all of us. It is now the number one killer of women in Ghana. So it is really important. This is a wonderful opportunity to be able to talk about this.
Yeah. I read in an article somewhere that breast cancer is the second most common form of cancer among women in the United States.
Yes,
It's
it
one of
is.
the leading causes of death among women. So early detection and improvements in treatments have helped millions of women survive breast cancer. Um, and so
Absolutely.
you at the time you were in the US. Tell us about a little bit about what happened and how you found out that you had breast cancer.
So at the time, I had just turned 40, and the normal routine after your regular physical was to get a mammogram. And leading into the mammogram, after finishing the mammogram, got a call back to do an ultrasound, and then a call back to do an MRI, and the MRI is what picked it up. So it was a routine check for me. I didn't feel anything. There was no history in my family. There was nothing at all to indicate that anything was brewing in my breast. So had I not been an advocate of a physical and a yearly check, this could have gone unnoticed, and Lord knows where it would have been now.
Mm, mm. So, Doc, I'll come to you now. First of all, if you can answer the first question, the importance of us talking about breast cancer, and also, I mean, I last year when I went to do my check, I was 37 at the time. I'm 38 now, and the doctor was like, you don't need to have a mammogram until you're 40. Is that correct? And if so, why? Even though they checked my breast, everything was fine, right? But I've got history. I've had my cousin, my first cousin, died of breast cancer. Um, isn't it important for you to have the mammogram earlier if you've got it in your family? I know I've kind of put in so many questions to you, but anyway, let's start from the top. Let's start from the top. But yeah, these are some of the questions I kind of have for you, Doc. So you can start
Okay,
from the top.
so I want to say welcome to everyone who joined us today. And as you said initially, breast cancer is the commonest type of cancer among women worldwide, affecting over 2.1 million women every year. And it's also the commonest cause of cancer-related deaths among women generally. And October is just the month we put aside to educate people on breast cancer and um, what they can do to diagnose themselves early, and then how we can help them treat it early because breast cancer is treatable. That's one. And then, as you said initially, we have screening methods, and there are three main steps in the screening methods. We have the self screening, we have the clinical screening, and we have the imaging. So, as a woman, you do the self screening by yourself, and then the clinical screening is done by your healthcare provider. And then, if your healthcare provider feels like you need the imaging, that's when it's requested for. So, for you, as you said initially, you have a family history and you were 37 at the time you went to do your check,
Mm.
and you wanted to do a mammogram. But the truth of the matter is that at 37, your breast is still dense, and we don't usually advise mammograms for dense breast. So, if anything, an ultrasound scan would have been better for you at that age. But then again, because they're following up on you closely, maybe they didn't feel like you needed the imaging done because clinically you need an indication. And then if there is an indication, we go ahead to do the imaging. So if you're doing your monthly screening and then your yearly clinical screening, you may not need the third type of screening, which is the imaging. So once you hit 40, then it is advised that every year after 40 years, you do the mammogram just to screen for the breast cancer. So after 40, the self breast exam and the clinical exam are not enough anymore. You need more, which is the imaging studies as well.
Okay. But when Jules spoke, she said that I know she was 40 at the time, but she had no symptoms. She didn't feel as if there was anything wrong. How are you supposed to feel? Is your breast supposed to be a different color? What are the some of the symptoms that you're supposed to feel? Are you supposed to feel like sharp pains in your breast? Are you supposed to have milk coming out? Like, what are you supposed to have? I want you to just break it down for people.
Okay, so the basics breast cancer is usually painless. When people talk about breast cancer, they expect to feel some kind of pain. But from my experience and other clinicians will let you know, mostly people, 90% of the time, people come in with painless lumps. But then also, there are other types of breast cancers that you don't even have any lump in there. It's just there, just like what Juliet had. There was no pain, there was no lump, but it was there and it was brewing. So the obvious things that you can look out for, you should know your breast because it all comes down to being observant. These changes are very subtle. So when they happen, sometimes it's difficult to pick them up. So you have to know your breast, the size, the shape, how they look like, how your nipple actually looks like, because it's that's there's no there's no top to bottom or bottom to top approach when it comes to breast cancer. The changes are skin, it can be skin change, and that could be the color, the texture. There could be dimpling, there could be an ulcer. The nipple, the architecture of the nipple could change. So your nipple usually points outwards, and all of a sudden it's retracting. You get
Okay.
that? And then you could have a what we call a boil. Usually Ghanaians call it a boil. You could have a boil, a random boil in your armpit. It could be related to breast cancer, so you should have that checked as well. And then nipple discharge. So what we advise is once you're not breastfeeding, you should not expect anything to be coming out of your nipple. So once you have any type of nipple discharge, then you should be worried and you should talk to your healthcare provider. It's not up to you to decide whether it's benign or not. Just talk to someone about it, and the experts are going to decide if it's something you should worry about or not. So, those are the common things you should look out for. If you have pain, if you don't have pain but you have lump in your breast, if you have a change in the color of the skin of the breast, if you have a change in the texture of the skin of the breast, we have something we call podorange. Everyone has seen how the orange looks like, right? So sometimes the skin on the breast looks like the peel, how the orange peel looks like. It has these tiny dots on it. Yes,
Yeah.
so you should look out for this as well. And then, yeah, the obvious ones, the nipple discharge, whether it's green, whether it's yellow, whether it's white, just talk to someone about it. But the most dangerous of them is the bloody nipple discharge. That is when we are actually worried about it. Yes.
Okay. All right. Jules, so after you went to the doctors, had the mammogram, did you then start getting symptoms? What symptoms did you
No,
you still didn't
there
get any
was
symptoms?
absolutely no symptoms for me at all. As a matter of fact, I seeked a second opinion because I wanted to be sure that what the initial doctor had, you know, seen was also consistent with the second doctor's advice. So I seeked a second opinion, and more tests was done, and it definitely concluded that I had a pea size of a tumor growing in the left breast. So luckily for me, what my second doctor advised was the initial doctor had suggested a lumpectomy, but the second doctor I saw suggested a mastectomy because I was young, I was 40. She was worried that the type of tumor I had, the nature of it was that it would usually would come back, and then sometimes it would be picked up too late. So it was really important for me to see and make a decision across the board on what I wanted to do, the choices I wanted to make. So I opted for a full mastectomy of the left breast and went into reconstructive surgery after that, and then proceeded for chemo to just be sure if there was anything left behind, that the chemo would also clean out everything else and I will come out very healthy and free of cancer. So that's exactly what we did.
How was the decision to cut off your breast for you? Like that's a very hard decision to make. Well, if you know the extent of breast cancer, I guess it's not that hard. But you know what I mean? Like that's your your
So
womanhood. Like how was it?
So I keep advising all of us that we have to be careful what we say, because our women are beginning to feel that they are defined by their breast. No, you're not. You are
Okay.
defined by the human being and the spirit that lies within you. So it's so important for us to be sure that we pass on this message of, even in the Bible, it says, if your right arm hurts, cut it off and stay alive. Now, what is my life worth to me? Is it worth my breast? Absolutely not. And so we need to really start injecting the messaging of, you, if the doctors have found something of this detriment in your body and could potentially kill you, why is it even open up for discussion? It should be where you make the decision you want to live for yourself, for your children, for your family, and for the community in which you live in. So it's a shame because culturally and religiously and preference of what men want and women, we fall for too many of this. We really need to not do that to ourselves. So
And
it
you
was
come
not difficult for me to make the decision at all. My
Okay.
husband said, you know, you do what you feel is best. And I was looking at him like, and you thought I needed permission? Absolutely not. This is my body, and I'm going to be the one without breast. Luckily, I have plenty of bottles for him, but that's neither there or, you know. So we just have to really realize the importance of, you know, not giving up. I remember running into a woman in Kumasi who, Mampokwa, was 92 when I met her. Her breast had been taken off at 37. Visiting doctors from outside of the country had gone into Kumasi to do some work and had ran into her. They felt a lump and they took her whole breast out. And she struggled with it in the beginning because, again, the stigmas were following her. But she lived a full life till she was 92. And that made me feel so amazing. So we really need to let people know that even the word cut off is so harsh. It's like I'm going to the butcher to just bam, cut it off,
Yeah.
you know?
Yeah.
So I just want us to start visiting maybe more kinder words or more, you know, medical terminology for it. That way our women are not, they don't hear it and are immediately afraid of what this cut off my breast is. It's not the end of the world.
Yeah, you're totally right. Doc, thank you so much for joining us. I know you're all busy doctors, but thank you for taking out your busy time to join us on today's show. As you know, it's still about breast cancer. And you messaged me as well. So, Dental, when are we doing our breast cancer show? This October. And then I got a message from Jules. Dental, it's October. And I'm like, yes.
Yes.
You know, let me
Hello,
quickly.
Jules. It's good to see you again.
Good to see you again, Doc.
So, Doc, a year on.
Hi, Amelia. It's good to see you too.
Hi, Bismarck.
A year on from our conversation, what have you seen? Have you seen more an increase of women getting breast cancer, or women, you know, coming for their checks? What are you seeing since we had our last conversation?
Thank you again for having me. I must say that I've seen changes personally. I've seen changes. I've seen more people volunteering to have their breast checked. Younger people, for that matter. I think the awareness bit is going down well. There's still a lot more to be done. I still feel like the information is still at the higher echelon. So really getting down to the grassroots as much. Because right now, most of the noise is being made on social media. So those who have access to social media definitely are being informed and are becoming more aware and coming forward for their checks. Those who are in school, they are getting the information. Those who have access to TV definitely are getting the information. I'm not so sure about what is happening at the rural level. Where I work is semi-rural, semi-urban, whichever way you choose to look at it. And the attendance, as in people who come forward to get their breast checked, you realize that most of them are people who are either elite or have had some form of education. But the commoners, rarely do you see them coming forward for their breast examination. When we go into the communities, definitely we drum it down and then they come forward. But the bit where we want women to actually come forward, women and men to come forward for their breasts to be checked voluntarily, I think that there's still a little more work to be done. But I mean, we've come a long way. 1 year down the line, I think it's better. You even have more media houses making noise about it, more companies, you know, setting that month apart to even have their workers examined. So I think it's a step in the right direction, but it needs to be watered down to the grassroots.
Yeah, Jules, how are you getting to the grassroots? How are you getting to the people who are not on social media? Tell us a bit about your foundation.
Yeah, soon after COVID, I had a bit of reservation throwing myself back in full force. So what we did was we did the presentation on a flash drive, and we tried to get as many to churches, to schools, to, you know, any platform that welcomed it, we pushed it out there. And that became what we did. If the church has a television, to show it to the, you know, the people who came in, and we tried to push through there. And I got on as much radio and television that I could, especially radio that reached into areas. And I think I interviewed more in the local dialect than I've ever done. So it was all in trying to reach, because usually we are on the road. This year our goal was to do, we had done the Anglonga side, and we were going to do the whole. Next year we were going to go to the north, begin the north. So we didn't get to. So I tried to push as much of the flash drive out, showing what to do, how to check, and then questions and answers that were common to every time I did a presentation. We answered those as well.
Okay.
So that's
and what are some of the common questions? What are some of the common questions that people
So the common questions stem from so many different things. You have the younger generation asking, if a boy sucks my breast, am I going to get breast cancer? You have from the older people, or even any woman asking, you know, if I do get it, how do I begin? Where do I, if I feel a lump, what is, doesn't mean I have breast cancer. So then we explain the steps in which they have to go through the doctors to do the proper testing to end up at the diagnosis. Food, is it contagious? You know, there's so many different questions that are pulled up, but we answered about 10 questions on the flash drive and pushed it out there.
Okay, fantastic. Doc, how are we getting the information out to the rural areas? Dr. Amelia.
Okay. So when it comes to the rural areas, I don't think it's very different from the urban areas. The only difference is that here in Accra, most people are educated, as Bismarck said, and we have social media reminding everyone to get screened. But in the urban areas, it looks as if they feel like taking time off work to actually do this is a waste of their time. Okay, so when we do outreaches, we go to the markets, and the outcome is amazing. Like, everyone wants to get screened because it is in the comfort of where they are working. Okay, they're in the market, they're selling their goods. They don't have to close down their shops just to get screened. So it all comes down to the Ghanaian culture.
Convenience. Yeah.
If you're not unwell, you don't go to the hospital. That's how everyone feels. They don't want to take time off their busy schedule just to go to the hospital and then for them to tell her she's okay. So my experience with the rural area is, when you take the clinic to them, they really patronize this whole screening thing. So it's all about empowering people to take charge of their own health so that they are more comfortable taking time off to take care of themselves instead of waiting for them to get sick before they go to the clinic. So I think it's a general problem. It's not just a breast cancer problem.
I agree with that. I think you're right. If we're not sick, we ain't visiting the doctors. It's not like the UK or US where you actually get reminders that it's your smear test time or it's your breast cancer screening time. You know, we don't have a system like this in Ghana. And so you're right. You have to physically go out there, talk about it, and do it in their convenience. Otherwise, it's not going to happen.
Because when you go out there, they have long queues. We stay there for hours because everyone wants to get screened. It's really tough out there. Once there's a doctor in the market, everyone wants to get screened. You don't get people feeling like, oh, they don't need to come in. They feel like this is a once in a lifetime opportunity. So see me, do what you need to do. But then if you go to your clinic, I'm not going to come there.
I mean, is there a way in which, how can we change that system though? How are we going to be able to change that? Or is it something that we cannot change?
It will take a very, very long time. It will take policies. It will take public education, a lot of things, really. Our mindsets, even as doctors, we don't do the screening test we need to go to. We're actually unwell. So I think it's more of a societal problem But we are working on it. We're working on it. Most of the clients we see now, it's not just what they came to see us for. Bismarck will tell you that now we're doing what we call health promotion, and we are giving the clients the chance to actually take care of themselves, to decide what kind of healthcare they want, what benefits them, what they do not like, when they should see a doctor. So it's something we're bringing up, but it's more convenient in the private hospitals because obviously money problems. Because in the public hospitals they are overworked, underpaid, and the volume of work is just too much. But talking from the private perspective, it's much better. And considering that a lot of people have corporate insurance, people are more comfortable coming to the hospital to get checked for things that the regular Ghanaian will say they don't need. So it's something that's coming up, but it will take time to get down to the less privileged. Let me put it that way.
Yeah. Okay.
Yeah,
Dr.
if
Bismarck,
I may, Denta.
Yeah.
Yeah.
Please go.
Yes, just to add a little bit to what Amelia was saying. Really, if we want to get the masses in and we want to make sure that a lot more people are getting screened and we are nipping some of these problems in the bud, yes, we are doing our bit. We are talking on here, but a lot more advocacy, I believe, needs to go on. The whole health system in itself, the public health system for that matter, as it stands now, does not really encourage people to come to the hospital. Just this afternoon, I was driving and I was telling my wife that, people would rather go to a pharmacy shop and then get medications because it's easier. Within 5-10 minutes, you tell your problems and then the pharmacist sorts you out. Okay. And then after a while, if symptoms persist after 3 days, you see your doctor. That is when they come to us. Because when you come to the public hospital, there are long queues, long waiting hours. You will wait at the OPD to see a doctor. After you are done seeing the doctor, you probably get some labs requested, and you're also going to queue to get those labs done or get that examination done, ultrasound, whatever you name it. You're going to queue again. And after that, you come back to the doctor. If there are medications, you are going to queue again. So you end up probably spending the whole day. And the average Ghanaian does not want to leave their work for a whole day just to get their breast screened. They feel they are not sick. So really, we need to improve. The whole health system needs to be improved if we want people, if we are going to really do well with this whole health promotion and health advocacy thing. Where, I know Ghana Health Services advocating for wellness clinics in all the hospitals where you walk in there just for some of these purposes, not just because you feel ill, but you want to get your breast screened, you want to check your weight, you want to check your blood pressure, so that you don't go and queue with everyone else. But even those ones are understaffed and they are usually really long queues. So I think we can start from equipping our wellness clinics, not only in the hospitals, but at the community level also, getting more staff in there. I know there are people at home who have been trained, but not yet employed. It's breast cancer. Let's not go into all that. But I feel like we are all part of a big system. And so if the big system is working well, the other small bits where people walk in conveniently, 5-10 minutes, they get their breast checked and they walk home, will also work. But if the whole health system it becomes difficult for the average Ghanaian. So I think that much as we are doing ours at our own level, at the top also, when we get a chance and when we get a chance to speak to the authorities I think we can push a little more in there, and then hopefully our wellness clinics will be up and running better at the public sector. Private hospitals is far easier, but at the public sector, Denta, I tell you, it's quite a struggle. Yeah,
I can imagine. What type of age groups are getting diagnosed with breast cancer that you've seen over the last few years?
Okay, previously we were getting older people above 40, 50, and even those ones were in the really late stages. But now I think with awareness, we are seeing younger people who are coming forward to get screened, and so we are detecting it a bit earlier. So 35. The youngest patient I've seen was 29 or 30, and it was actual breast cancer. Initially, they thought it was just a benign breast mass, But upon further investigation, yeah, we realized that it was a malignant, but thankfully it was just a carcinoma in situ, so it hadn't really spread. So just a wide local excision, and then she's all right and she's fine now. Yeah, so
Okay.
I think I really, when you check, you pick it up at an earlier stage, and it makes a whole lot of difference than the
Yeah.
older people who report rather late after going around and around and around, having their monies spent on other things before they come. Yeah.
Yeah. You know what? Can we break down the cost implications? So that people can understand the importance of getting that pre-check, so that you don't have to go through this type of financial burden which your family is not prepared for. What are some of the things that you'd have to pay for? Jules, I'll come to you, and then I'll go back to the doctors to kind of, go into details. That what are some of the things that you had to pay for?
You're coming to me first, right?
Yeah.
Yes.
Okay. So to piggyback a little bit off of Doc with the younger generation, the younger people, the youngest I have seen is 18. So we personally helped a 24-year-old a few years ago, and her tumors have come back. So I'm saying this to say that definitely in Ghana, we're seeing younger and younger. I'm running into too many 27-year-olds, 26-year-olds, and
Wow.
it breaks my heart because it's a shame that so young they have to face this. The cost factor is realistic. Every year when we come to donate, now Pink for Africa donates to Korle Bu every 3 months. Our goal is to be able to come every month, raise enough money to come every month and really impact and really be able to take a patient from beginning to end, especially those who cannot afford it. But like Doc said, the early detection is what is going to not only save your life, but also be gentle on your pocket. My treatment in the United States was well over $300,000 because they went above and beyond in so many testing and so much more. Ghana has a way of, streamlining certain things to really save the patient. And the government does subsidize to a degree, but it's not enough. Your average Makola woman makes an average of maybe $100 a month. To tell her that she's diagnosed with breast cancer, even the beginning stages, to get her screened, to get her, biopsied, to get blood work, she cannot afford. So when she leaves, the chances of her coming back is almost none because there is no hope for her to be able to afford this. So early detection is without a doubt. It will definitely be gentler on your pocket.
Doc, anything to add to that?
Yes. So when people talk about cost, they think about the labs you're going to do, your radiotherapy. I mean, the direct effect of the cancer on your pocket. But let's think about you taking time off work because now you're actually sick. So there's no income coming in. And then your trips to the clinic, who is paying for those? And it's just the little things, okay? So it's definitely more expensive when you wait it out because now we're not just talking about breast cancer. You have an infected ulcer on the breast which is giving you some sort of sepsis, and sepsis is just infection that has spread through your bloodstream, let's put it that way. So we are talking about more complicated things. So now we've moved from taking care of you as a breast cancer patient to taking care of you as a patient with several comorbidities. So it is expensive, but I feel like it's more expensive to wait it out because breast cancer, you can't just decide, oh, I have breast cancer. I'm going to die anyway, so I'm just not going to do anything about it. While you wait to die, there is a lot you will go through. So
Yeah.
I feel like it's just better to come in. And as she said, Korle Bu is doing the best they can. When I was in Korle Bu a few years ago, even the students used to pitch in for our cancer patients. There's always someone who is interested in helping out. So your job is to show up and do the best you can, and then leave the rest to God and the good people of Ghana. Because some way,
Yeah.
somehow, a lot of people are getting into this crowdfunding, and you always find support groups that are there to help you. Kolibu has several lists of people that are willing to help. So yes, it's definitely expensive, but also there is help. So you don't have to do this alone. I think the theme for this year worldwide it's is buddy up someone because you don't have to go through breast cancer alone. So generally, it's not just in Ghana. I think people know how tough it is for survivors. So those that are willing to help and can help are going to do that. So you don't have to stay home and die.
Yeah. Yeah.
Yeah.
I think it's, and there's also that emotional, psychological thing that we need to talk about. Because a lot of women are scared, one, to get a message that you may have breast cancer. That's one. And two, how to deal with their family. Some people still don't even want to share it with their husbands, their partners. They want to keep it to themselves. How are you doctors managing those type of situations, Bismack?
Um, it's usually difficult. Again, I'll speak from my own experience. I am in a, like I said, semi-urban, almost rural, Ankafo Leprosy General Hospital. That's how far I am, and I'm surrounded by only small villages. And so the story of the stresses that the family go through, and then the stresses that patients who are diagnosed with cancers of any form, breast cancer specifically, go through. It's not news to me at all. And for us, I want to talk a little bit about the challenges that we face before. I go into what we are doing. The challenge is that you have a stressed family, and then you have equally stressed health workers, overwhelmed health workers. So you can imagine, if I'm less stressed, I'm in a better position to offer psychological support to the family or to the patient. Okay, but if I am in a position where I need support myself, then it's difficult to give that. So that is really the reality on the ground and where we are right now. But that being said, like what Emilia was saying, there's always someone who is interested in the cancer patient. There's always at least one person who is willing to stand by the patient, to support the patient, to go the extra mile, to make sure that the patient is feeling better. And usually, once you are able to speak to them, offer them some hope, make them understand what they are going through, because some of them don't even understand it. For them, breast cancer is equal to death or getting their breast cut off, and that immediately spirals them into depression. So once you're able to explain to them the diagnosis that they have, and then let them know all the treatment options that are available, and that if they're able to take a step, this can be done about it. Link them to available health groups who can support with treatment. Once you're able to do that, most of them have their fears allayed. And then they actually have a little hope. And in my own experience, most of my patients who have at least a little flicker of hope tend to do better than those who do not have any kind of hope. And it's also been shown that cancers generally have a link with a depressed mood. So once your mood is depressed, constantly depressed, it just predisposes you to developing cancers. And imagine someone who already has been diagnosed in a depressed mood, the cancer just grows more. And that one has been proven. So the psychological bit is very important. We do our best, but I must say that it is not optimal. And that is why I give a little background to where we are, and then the issues on the ground. So it's not really that easy, but we try our best. There's always at least one health worker who is willing to stand by the patient and offer them the psychological support that they need to go through.
Okay. So can you read Doris's comment on the screen?
Okay. Great awareness. I have a friend who was always checking her breast in secondary school. In 2012, she discovered something in her breast. It was cancer. She had chemotherapy, had surgery, she went through radiotherapy, and had an implant. But after 6 years, we lost her. All this was in the US. She was just 43 years old. So, Doris will
Is this a
say,
common
we
story?
are
Is
so
this a
sorry.
common? Is this a common
Yes,
story?
definitely so sorry.
Yeah, yeah. We are very sorry for your loss, but as we said initially, breast cancer, just like any other sickness, even malaria has a treatment through and through. We still lose some patients through even the stuff that's seemingly simple. So she had a good fight, but unfortunately, you guys lost her. But there are other people, there are millions of other people that
Who
went
have
through the same thing
survived? Yes.
and survived. So they
Yeah,
are
who have
survivors. So
survived.
the fact that other people didn't make it doesn't mean that we should stop fighting, because it's worth the fight. It's a human life we're talking about. Okay,
Yep.
Yeah.
people, as when we began, Juliet mentioned someone who lived up to 91 years. So life after breast cancer, it's very, very
Mhm.
fulfilling. There are
Possible.
people that lived
Yeah.
a long full life, and possible, yes.
And I am 13 years in. But to piggyback off
Mm.
of what Doc just said, you know, what I've seen mostly in our communities when it comes to breast cancer is that there isn't enough support for the woman, especially from her husband or from immediate family. A lot of immediate family try to get her around, but the support from the man who she wakes up with every day is paramount. You know, if you go to the men's ward, you're going to see a wife, you're going to even see a wife and a girlfriend attending to one man. And then you go to the women's ward and you see that very few men, if any, are there at all. And statistics have shown in Ghana that the women whose husbands hold their hand through the process actually heal and do so much better. So the support system is key. I know I could not have done this without the support of my husband. So it is really, really important for us to encourage our men and for the community, the immediate community we live in, to stop with the foolishness and the stigmas and you did this, that's why you have cancer, you got breast cancer, and try to be of a support for each other.
Yeah, I think everything it's like everything is linked to witchcraft or Beye or
Yeah,
like the
unfortunately.
stigmas. It's a lot, or what you
Yeah.
It's
did in your
crazy.
past, and
So
it's because you did this and that. You're a bad person. That kind of thing.
yeah.
And I think we really need to get over this. We really need to
We
get
do.
over that
We
hurdle
do. We
because
do.
You know,
it's not helping.
yeah. Denta, last year, I think the last time we had this discussion, I shared a personal story of a relative that I lost to breast cancer. And honestly, the background, the truth of the matter is that we lost this relative because, on our hindsight, she was not attending the clinics that she was supposed to attend to. Um, she had she had some prayer group or something that she was attending. So for a long time, so it took one of my cousins, to prompt us that this is actually what is happening. That she's not being um, she's not going to the clinic, she's not attending the clinic, she's not on medication, and the thing is getting worse. So that was when we stepped in because I wasn't on the ground either. So that was when we stepped in, by which time it was so late, everything had metastasized. Meanwhile, at the initial stages, when we got in, we initiated treatment, which was supposed to continue. But so, I feel like now we are advocating, now we are talking, we are in the churches, we are educating people, we are the herbalists, we are talking to them as well. So even though they try to do their bit, now they are a bit careful. They don't keep patients there for so long. They'll
For
keep
too
you there
long.
for then they will tell you, oh yeah, doctor
Into
but
call Dr.
the
Foho.
patient, yeah, the patients come and tell us that we were in this garden for 7 days, and that is what is happening to the everyday Ghanaian. I have lived it, and it is not pleasant because I know that she stood a chance had it not been for this detour that was made. And unfortunately, that is what is happening to the everyday Ghanaian. And so it brings to mind that this education, like we are doing, shouldn't only be around us, but people have faith. People, these spiritual leaders, they are pastors, they are herbalists, they are malams. People have a lot of faith in them. And so, if they are educated, they will at least be able to recognize the signs and symptoms of breast cancer and refer them appropriately and in good time. And I think that's something we are doing, but I mean, it's something we can do more. Yeah.
Okay, so to add to what Bismarck just said, social support I feel is very, very important. Just like Juliet said, there's no way people can go through cancer generally without the support of their families. And in Ghana, mental health is sort of embodied in the society that the person comes from. So when you give someone news like you have breast cancer, that's when they zone out. They're not listening to you anymore. Okay. But if they have a husband, a sister, a friend, they are listening to what you're saying so that when they go home, I need to remind you, oh, she said you had breast cancer, but then we can do this and this and this about it. You will go through your phase of, I'm sad and why did I get cancer and all that. But when you're done with that phase, there's someone to pick you up and support you through your journey. Okay. So what we are missing as Ghanaians is that support, because everything is, as you said initially, Beye, and how my husband is finding a new girlfriend just because I'm going to lose my breast. And they forget that whether you take the treatment or not, the breast is sort of gone. Okay. So even though you refuse treatment for your husband is still going to find another person, because either ways the breast is gone. It's not there anymore. Okay. So I won't it would be unfair to say we're not getting anywhere with the public education, because now I see a lot of partners come in with their husbands, and the husbands
Yeah.
are actually asking questions. Okay. So even though it's more geared towards women and their health, their husbands are sort of being supportive when it comes to breast cancer. So we still have a long way to go. We still have a lot of work to do, but we have made some progress when it comes
Yeah.
to family support. Yes, when it comes to family support, and then I'll always refer to Kolebu because that's where I trained and that's where I know. When they have the second floor was the breast unit, and they have a psych unit just for that. So they
Yes, they
used to have
do.
a psychologist. Yes, they used to have, when I was there, they had a psychologist and a psychiatrist who used to see just the cancer patients. So they used to deal with the emotional and mental bit of it. So the treatment is not just clinical. We know that we have to treat you mentally as well. So they do this as well. They offer that kind of treatment as well.
Wow.
And they are doing a fantastic job. I have a personal
They are.
relationship with that whole unit, including the psychologist, and she is phenomenal. I have to definitely, both Okonfa-Noche and Kolebu, absolutely phenomenal. I have seen them firsthand, really talking to patients and trying to calm a patient and and I've been very moved by that. So I have to recognize that.
That's good to hear,
That's
because
good to
we always
yeah.
get negative about
Uh-huh.
the health service and all of that. There was a comment that was made um, in in the comment section. Somebody sent me a question privately and said, "Is it to do with the type of bras that we wear as well? Are we wearing too much of a tight bra? These are like questions and concerns that people have. Does that have any
Okay.
effect on breast cancer at all?"
Okay, so that brings us back to the causes of breast cancer. Everyone wants to know what causes breast cancer so that we can just, run away from it and then we don't get breast cancer. But we don't have we don't have a single cause of breast cancer. We have just identified some risk factors that are associated with with breast cancer. So to deal with that, let me just go through the risk factors quickly, and
Yeah.
then we're going to answer the question about the type of breast people
Mm.
use.
Yeah.
So for the risk factors of breast cancer, they are broadly divided into the modifiable risk factors and the non-modifiable risk factors. The modifiable risk factors are factors that you can change, things you can do something about. Okay. And non-modifiable risk factors are things you can do nothing about. So let's
Okay.
start with the stuff you can change. We're talking about obesity, especially postmenopausal obesity. So we want people to maintain a healthy weight. because once you have your postmenopausal obesity, you are more at risk of getting breast cancer than someone who is in a better shape. And then we have alcohol intake, and then smoking. And then we can talk about general stuff such as fatty diet, and then lack of exercise. Okay, so these are the stuff that you can actually change, stuff that you can actually do something about. And then when we come to things you have absolutely no control about, your gender. So just by the mere fact that you're female, your chances of getting breast cancer is definitely higher than someone who is a male. Not to say males do not get breast cancer, but their risks are definitely way, way, way lower than females. But in Ghana, you guys should be more careful, because I think the percentage in Ghana is slightly higher than the worldwide percentage. So yes. And then we have your age. So as we initially said, once you're over 40 years, your risk is actually higher than someone who is definitely younger. And then we can talk about menarche. If you had an early menarche means the age at which you first had your period. So if you had an early menarche, then your chances of getting breast cancer is higher than someone who had their period maybe later on in life. And by early menarche, I mean 12 years and below. That's considered early menarche. And then let's talk about menopause. People that had late menopause have more, they are more at risk of getting breast cancer than someone who had an early menopause. So early menarche, late menopause, it means in between, you're exposed to a lot of estrogen. So that's what makes your risk go high. And then we can talk about previous history of breast cancer. So someone who has had breast cancer before has a higher chance of getting it again than someone who's not had it before. And then we'll talk about previous history of breast disease. This is very important because this is what I'm going to use to answer the question about the bra. Okay, so let's keep that in mind. And then you have, if you have a previous history of other cancers such as ovarian cancer and endometrial cancer, then you have a higher risk of getting breast cancer. We have some genes, BRCA1, BRCA2 gene. It sort of runs in families. So if that gene is identified in your family or in you, then your chances of getting breast cancer, it's a little bit more higher than someone who didn't have it. And then we have endocrine factors. So these factors are a bit weird because some people have control over it, others do not. So we're very careful where we put them. These endocrine factors are the age at which you have your first baby. So I am 29 and I don't have a baby yet. So my chances of getting breast cancer is definitely higher than my kid sister, who is 26 and she already has a child. Okay. So when we talk about early childbirth, we are saying it's protective against breast cancer. And if you're going to have a baby and you can, breastfeeding is actually protective against breast cancer too. So breastfeeding is protective. And then nulliparity.
What about normal
If you-
husband? What about normal husband sucking? That's another one that keeps coming up. What is the difference?
is not protective. It's nice, but it's not protective.
Okay.
So it's I mean, it's nice, and people feel like their husbands are even more conversant with their breast than they themselves. So maybe it's
That's
just
probably the
familiarity with the
advantage.
breast. That's the advantage, because once there's something different about the breast, husbands are the first to notice because they are good people. Yes, so that's the advantage when it comes to men. But then when it comes to breastfeeding itself, baby breastfeeding is what is protective.
Okay.
Nulliparity is a term used to describe people who never had children in their lives. So if you go through your adult life and you never had a child, your chances of breast cancer is definitely higher than someone who had a child in their lifetime. And then the age at your first pregnancy is also important. It's been shown that when you have your first child after 35, your risk is actually higher than someone.
Uh-oh.
Oh,
Doc. Okay, Dr. Bismarck,
Okay.
you continue from there.
yes. So let me just sum everything that Emilia is saying. So the idea is that the longer you are exposed to estrogen and the things that stop the longer you're exposed to estrogen, the higher your risk of developing breast cancer. Now, the things that cause the exposure include breastfeeding, include pregnancy. So when the whole period that you are pregnant, your estrogen levels are under control because that's what controls your cycle, and you are not having that at that moment. When you are breastfeeding, also the estrogen levels are a bit low. Okay, so the longer you're exposed to it, the higher your risk. So if you started menstruating early, that means that you started getting exposed to high levels of estrogen at an earlier age. And then if you had your menopause late, it means that the whole period you were exposed to estrogen. Imagine if you had early menarche, late menopause, and between you never had a pregnancy or you never breastfed or something like that. That also doubles your risk. And then at the same time, if over the period you maybe had a previous cancer or previous breast disease, that also increases your chances or the risk of developing breast cancer. She was talking about the previous history of breast disease. So, for example, if you've had maybe a breast abscess, that means you had a boil in your breast and then something was done over there. Once the tissues in there have been tampered with, they usually tend, not usually, but they may have a propensity to undergo metastatic changes and then become cancerous in future. It's not always the case, but it increases the risk. So any previous breast disease that you've had can actually increase the chance or predispose you to developing cancer in future. Some bras that women wear sometimes cause irritations, rashes, and some of these rashes can develop into get into the tissue, the breast tissue itself, develop an infection, which will be treated, and then later in life will just increase your chance of getting breast cancer. So I think that's just about the little link with the kind of bras that we wear. The specific types, whether it's tight or loose, I know that studies have been done about these ones, but the links are actually really weak. So I mean, in our world, we are trained as scientists, so we usually want to speak with evidence and what the research is saying, but the links are actually really weak between the kind of bra you are wearing and then the risk of developing breast cancer. I think the strong link would be if you've developed any disease from the kind of bra that you've worn in the past, that will rather increase your chance of getting breast cancer. Okay. I hope I summed everything.
Yes, you did. Thank you so much. So Doc,
right.
Your last words to people who are watching, encouragement of getting examined, and encouraging family members to actually go together. Sometimes it's more fun if you go together as a group, and just make it as like you go out for the shopping mall or whatever. Go out with a group of friends and go together, and then that could be your support system as well if anything was to come out from that. What are your last words to people who are watching?
I think pretty much you said my last words. But just to add to that, I would want to encourage everyone who is watching that breast cancer is curable, is treatable. We always get to hear the horrific stories about breast cancer and how you're going to die and how you're going to get your breast cut off and all that. But I've seen people survive. Jules is here. She's gone through it and she's here. You can barely tell that she's gone through anything like that. So there's actually hope. And I'm glad that we're having a lot of education ongoing. And just like we do for every other thing, once you hear any good news, you share it with other people. Okay. When the woman at the well, when Jesus spoke to her and then she got the good news, she went into town and then spread the good news to everybody. So if you've also had your breast examined and there was nothing, encourage your friend who probably might be scared. Oh no, it's not a scary procedure. Some people are actually even a bit skeptical about having somebody else examine their breast and all that. All these cultural issues that come with it. But if one person in a group, you've had your breast examined, that's something that you should wear proud. That, hey, I got my breast examined. You should definitely get yours done too. And once we identify it early, it makes a lot of difference. when any disease, when any abnormal lesion is identified, it makes a huge difference. So yeah, everyone should get their breast examined.
Thank you. Thank you
Thank
so
you.
much, Dr. Bismack. Jules, your final words to people who are watching today.
So my final words this month and for 2021 October has been to encourage our women to share their health history with their families. When the women in your family know what happened to you with breast cancer, the chances of them also checking early on it works. So please, this hiding what we're going through and not sharing it is really not helping our families to know the health history. So to encourage women to please share so that your nieces, your sisters, your mothers, your grandmothers will all know, and going forward we can all make, a more educated decision on self-examination and checking and detecting early. That would be my advice.
Thank you so much for the amazing work that you continue to do.
Thank
Jules, we
you.
can't thank you enough for, I don't know how you do it. But we see your work, and you are really impacting on a lot of women's lives, and they really, really appreciate you. So God bless you. May He give you
Thank
the
you.
strength to continue, because I
Amen.
know it's not easy. The financial burden and all of that kind of stuff. But you
Yes.
you keep at it and you keep pushing. I'm praying that a lot of people will also, um, find out more about the foundation and also donate. And I think, Dr. Amelia and Dr. Bismack, you should be working alongside Jules a lot more in what she's doing to raise awareness of breast cancer and supporting these women who have breast cancer.
Breast cancer.
I think, you definitely need to make that connection with her.
Thank you so much for this opportunity.
Very
Absolutely.
welcome. You're very welcome. Lastly, Dr. Amelia, don't worry. Dr. Bismack stepped in and
I
wrapped
was
up
so glad he was here.
very nicely, so you don't have to worry about that. But
Yeah.
your last words to people who are watching, your encouragement, your words of wisdom for people who are watching this evening.
Okay, so Breast Cancer Awareness Month, October, but awareness should be ongoing every day of the year. But worst case scenario, get screened at least every October. It's very important to have that done. And as we said initially, family support is very important. So as a society, we should be open to supporting our friends, our families who have to live through breast cancer or any sort of cancer, so to say. And encourage someone today, encourage someone to get their breast screened, encourage someone to get a mammogram done, encourage someone to talk to a healthcare provider about a breast issue they have. And if you can afford it, support someone with your time, your money, resources, whatever they need. Because it's tough out there. It's tough for survivors. So however you can contribute, you should do that. You should do that. So my advice is not just for the
Awesome.
women, it's for the supporters,
Yeah,
supporting team
yeah,
behind
the
us. Yes.
family, absolutely. And so on that note, Dr. Emilia, I'll be coming for my screening with you next week.
Oh yes.
Um, I haven't done mine yet. This has been a crazy month, but that's what I'm saying. We say it's crazy, but Charlie, I don't want to be here with no build. To me, if I
Mhm.
Martin.
come and see you, get my screening
Yes.
done, so at least I can have a little badge say I've done it, and encourage other people to do it. Guys, let's get screened. Let's not let time, um, you know, bang us down and say, I don't have time to do it. But when they do say you have breast cancer, you will make time to go to the hospital. So,
Yeah.
have time now, and worry about the rest later. But it's so important that we all get checked out. So every woman and every man that's watching, it affects all of us. So let's go out there and get screened. Thank you so much, guys, for joining me on the show.
Thank
Really,
you. Thank you for having
Thank you
us.
for having us.
and hopefully I'll see you next year again for
Yes.
another show
Mhm.
on
Yes.
breast cancer. Take care. God bless
Yes.
you all.
All right.
Yeah.
Bye-bye. Thank you so much, guys, for watching the show. Another great conversation. I'm going to be having my screening done next week. Please go out there and do yours. It's so important. We can't shout loud enough. We can't shout it out loud enough. You know, Juliet, you know, you can see her now. You know, she's been through it. Trust me. I'm sure there were times where she's crying and tearing out her hair. She was losing her hair. She lost a lot of stuff. You know, couldn't go out, you know, wanted to be home by herself. You go through all of that. But, you know, once she got checked, she was able to get help. And that's exactly what the position that I want each and every one of us to be in. Not when you're in stage 4, stage 5. You know, we need to make sure that we catch it early and get rid of it and have peace of mind and go on with our lives. So guys, thank you so much for watching the show. A big thank you to World Remit for sponsoring the show. You could join up to 5.7 million people who are sending money back home to the continent. Thank you so much once again. God bless you all. And please do share the show. Let somebody else get this message. Take care. God bless you. Bye-bye.